Honorable Sénateur.
Honourable Senators, welcome to this meeting of the Standing Senate Committee on National Finance. I see that we have quorum, and I declare the meeting in session.
My name is Percy Muckler, Senator from New Brunswick and Chair of the Committee. I wish to welcome all of those who are with us in the room and viewers across the country. This evening, our committee continues its special study on the proposed changes to the Income Tax Act respecting the taxation of private corporations and the tax planning strategies involved. Changes that the Minister of Finance proposed during the summer of 2017. Today we have before us national organizations from the health sector. They were asked to give their opinion on the impacts of the proposed changes. And to the witnesses, thank you for accepting our invitation and to share with us your comments, your views, and your analysis. From the group called Concerned Ontario Doctors, Dr. Kulvinder Gill, President. Welcome and thank you for being with us this evening.
Good evening. My name is Dr. Kulvinder Gill. I am a frontline physician practicing in Brampton and in Milton, Ontario, a medical educator, a small business owner, and the co-founder and president of Concerned Ontario Doctors. I thank you for the opportunity to speak on behalf of Concerned Ontario Doctors this evening. In 2000, Ontario granted physicians the ability to incorporate in lieu of fee increases. The government had even encouraged doctors to use incorporation as a vehicle to save for their retirement. Now more than 70% of Ontario's doctors are incorporated. Although physicians bill the government for the patient services that they provide, physicians are self-employed, have no pensions or benefits. Physicians cover all of their own overhead expenses, which on average to 30 to 60% of their fees, funding healthcare infrastructure, and they must generally service an average student debt of $250,000 accumulated from 10 to 16 years of required university training. Physicians are unique small business owners in that they are not able to pass their increasing overhead expenses on to patients, as their fees are fixed by the government. As a result, cuts to doctors are a direct cut to patient care. Faced with the largest debt of any sub-sovereign borrower in the world, the Ontario Liberal government has actually resorted to rationing patient care by unilaterally cutting more than $3.5 billion from the patient services that Ontario's doctors provide since 2015. Add to this multiple provincial healthcare legislation over the past year, hurting patients and stripping physicians of their autonomy and their human rights, and you have the making of a healthcare system in crisis. In recent years, governments have attacked and they have vilified doctors. 63% of Ontario doctors report burnout, which can very quickly lead to compassion fatigue, anxiety, substance abuse, depression, and suicide. The suicide rate amongst doctors is already more than twice that of the general population. An astounding 81% of doctors reported feeling attacked and vilified by the Ontario government and 70% by the Canadian government. There have now been 3 independent surveys of Canada's physicians about these proposed tax changes in Ontario, New Brunswick, and in Nova Scotia, and sadly the results are consistent. The vast majority and upwards of 85% of these Canadian doctors report that the proposed tax changes will force them to change how they practice medicine. In Ontario, 75% plan to reduce their working hours, 55% plan to reduce patient services, and 39% plan to lay off staff. Since these tax proposals were announced in the summer, a quarter of Ontario doctors report having already cancelled plans to expand. The end result will be frightening. More patients suffering and dying on wait lists. If these tax changes are implemented, 21% of Ontario doctors plan to leave Canada, 26% plan to retire early, and a shocking 11% plan to leave medicine entirely. An alarming 35% of medical students and medical trainees plan to leave Canada. If doctors follow through on these plans, it will likely exacerbate the already high burnout rate amongst the 88,000 Canadian physicians, which is at over 50%. The recent changes announced by Minister Murnau over the past week do not alleviate physicians' concerns. In the name of fairness, physicians are being targeted and treated unfairly. As a young, female, visible minority physician, I represent the changing face of medicine in Canada. Since 1970, the number of practicing female physicians has grown dramatically from 7 to 41%. Now approximately 60% of all medical students are women. These tax changes disproportionately hurt female physicians who must use their corporations to fund their ongoing clinic overhead expenses while at home taking care of their newborns. It creates roadblocks for women wanting to pursue medicine and entrepreneurship. A full analysis looking at the gender implications of any proposed tax changes is critical. The parents of many physicians had struggled to join the middle class, and many had withdrawn their own RRSPs to fund their children's medical school education. The changes to income splitting will now leave the senior parents of many physicians without a pension. Similarly, many physicians will no longer be able to help pay for their spouse's retirement, and without any RESP contributions, many will no longer be able to fund their children's university education. This is unfair to small business owners, as public employees are still able to income split their pensions with their spouses. The limit of $50,000 per year set on passive investments within the corporation will place immense restrictions on the ability of physicians to utilize their corporations as a means to save for a rainy day fund, future investments into their clinics, mat leave, and their future retirement. How existing corporations will be grandfathered is unknown, and this will create another administrative burden. The annual limit of $50,000 will be most burdensome on the physicians early in their careers, many of whom are not able to start saving for their retirement until their late 30s or early 40s. The annual limit is an unfair burden on small business owners, as no such limits or increased tax rates exist for the public sector pension plans, which average at $3 million in their assets. The strains on Canada's healthcare system today are far greater than those that existed prior to the mass exodus of physicians during the 1990s brain drain to the United States. We are entering uncharted territory, with our senior population projected to grow by over 68% in the next 20 years. Canada's healthcare system already ranks third last amongst the wealthiest countries in the world for accessibility to care, has more than 5 million patients without a family doctor, idle operating rooms, and patients waiting upwards to 3 years for specialist care. Add in a likely mass exodus of doctors, and you have a recipe for the collapse of our healthcare system. Concerned Ontario doctors' Canada-wide petition to stop these unfair tax changes has garnered 54,561 signatures and continues to grow. The government's proposed tax changes for small business owners will have a detrimental impact on Canada's health care. A full commission is essential to truly understand the far-reaching implications of any proposed tax policies. Canada's patients deserve better. Thank you for taking the time that's needed to study the far-reaching implications, and I would be happy to answer any questions.
Thank you, Doctor.